Hi, my name is Kendra. I'm going to be discussing hepatitis C. So hepatitis C is a viral infection that affects the liver. It is considered to be one of the main causes of liver-related deaths. When a healthy individual comes into contact with blood from a hepatitis C positive individual, this is how the virus is transmitted. So hepatitis C is a non-cytopathic virus, which means that it spreads without killing the host cells. The virus initially circulates through the blood, and via the circulatory system, it then enters into the liver. When it enters the liver, it comes into contact with hepatocytes, which are the main liver cells. The virus will then infect and replicate within the hepatocytes. When this virus goes untreated, it further infects these hepatocytes and leads to hepatocellular necrosis, as well as cirrhosis. Risk factors include IV drug use. If individuals who are hepatitis C positive are sharing IV drug supplies, this can spread the virus. Working in a healthcare setting is also a risk factor. If you're administering an injection to an individual who is hepatitis C positive and you endure a needle stick after, this can transmit the virus. Individuals who have received a blood transfusion before the year 1992 are also at risk of having hepatitis C. After in 1992, they began to screen blood for hepatitis C and other illnesses to prevent the contraction of hepatitis C via blood transfusions. So major signs and symptoms. So for acute hepatitis C, this usually will occur if an individual has been infected for weeks or a few months. So these individuals will typically not present with any symptoms. If they do, it includes right upper quadrant pain, feeling very fatigued, and if it's left untreated, it can progress to joint pain, dark urine, and jaundice. So chronic hepatitis C is if an individual has had this for longer than 6 months. This can lead to liver cirrhosis and end-stage liver disease. Symptoms of chronic hepatitis C include peripheral edema, hepatosplenomegaly, jaundice, and bleeding and bruising easily. Also, there is something called Factor hepaticus, which is a breath smell of rotten eggs and garlic. And this is found in individuals who have end-stage liver disease. So diagnostic testing to determine if somebody has the virus, there is an HCV antibody test that is done. It's a blood test and it detects if an individual has hepatitis C antibodies. The results for this test can take days to weeks. There is a rapid anti-HCV test, which also detects if hepatitis C is present in the blood. And this test will show results 30 minutes after, but not all health clinics have this available.